The first human-to-human transmission of coronavirus in the United States has been documented in Illinois now. Officials say a 61-year-old woman who contracted the virus last week passed it on to her husband. She had been in Wuhan during mid-January but wasn't showing symptoms then. A week and a half later, she was put into quarantine with shortness of breath and a fever. She is now being treated in isolation at St. Alexius Hospital in Hoffman Estates, and her condition is being described as being good. Right now, we do not have details about her husband's condition. This is the second case of the virus in Illinois and is believed to be the 6th confirmed case across the country. I'm Ken Molestina for CBS Chicago.
Here's Marissa Power live at St. Alexius Medical Center in Hoffman Estates, where we've learned both patients are in isolation. Marissa.
We now know that the man is here, right behind me at this hospital in Hoffman Estates at St. Alexius. We also know that he's stable and that he has been here for at least 2 days. The newest coronavirus victim got the virus from his wife, both of them in their 60s, both Chicago residents. Because of the man's close contact with her, doctors have been monitoring him since last week. On Tuesday, he started showing symptoms and doctors immediately put him in hospital isolation. Unlike his wife, who is otherwise healthy, we've learned he has an underlying health condition. Last night, doctors got the test back from the Centers for Disease Control and Prevention, confirming his case. But he was already in isolation, and now officials are closely tracing his steps.
But we know already that, just like his wife, he has not, for example, taken the L. He has not attended any large gatherings.
But the CDC is still closely investigating everywhere he traveled in the last 2 weeks and anyone he came into close contact with. Close contact, according to the CDC, is defined as 10 minutes of face-to-face contact. Now we've learned there could be others.
Currently in Illinois, there are 21 individuals who are considered persons under investigation.
But Chicago Department of Health would not tell us how many or if any of those people under investigation had been in close contact with this husband or wife. Health officials maintain nonetheless that there is no local emergency and the Illinois public is at low risk for the virus. Today, officials say they have no reason to believe the man got the virus from his wife before she started showing symptoms. Ahead at 6, we'll tell you what the hospital is doing to help keep the virus from spreading further. Live from Hoffman Estates, Marissa Parra, CBS 2 News.
This news today is really a continuation of the news we announced last week when we shared information about the first confirmed case in Illinois in a woman in her 60s who had recently traveled to Wuhan. That first case patient is doing well. She remains hospitalized and in isolation primarily for infection control. Our newly confirmed patient is a man in his 60s, as you heard, the husband of our first confirmed case. He is also currently hospitalized and in stable condition at this time.
Significance of this new development?
Yeah, absolutely. So obviously it's a scary headline to see, but the fact that this is two people that were in close contact, the sort of situation where you might, sort of assume would be the most likely kind of transmission to happen, that's pretty reassuring. It's not like we're seeing, cases pop out of nowhere. This is something I imagine the CDC was already watching. They're looking at people who have traveled to China, those close to them. So I wouldn't say this should dramatically alter anyone's opinion of how serious this is.
I mean, for those who live in the United States, we're particularly focused on what happens in the United States. But did we basically understand people could transmit it to other people in China, for example? Is that a development?
We already understood that's what's happening.
See.
Yeah, so this can be transmitted via droplets. The question is how easily that happens. That's still open, whether it can happen when people aren't showing symptoms. But we are getting the sense that is something that happens with some frequency. The fact that this is not so severe might be a potential avenue for further transmission. So on one hand, you're sort of reassured by the fact that the death rate isn't that high, but the fact that it isn't so serious means that it could go pretty far without people actually noticing too much, which is a little scary.
Max, what as a practical matter turns on whether the WHO declares that or not? I mean, are there funds that get released? Are there actions taken by governments? Or what happens if they decide that?
So the biggest shift, the biggest consequence is that the WHO will get more power to sort of collectively direct government responses, to have a more standardized response, to demand, data in a certain format. At the end of the day, if they do end up declaring that, I would caution people to not take that as a sign to panic or something. It's just acknowledging that there's been enough of a spread, there's been person-to-person transmission in enough countries that it's worth coordinating a global response more directly by this organization that does have a lot of experience with these sort of global epidemics before.
On the United States side, we had President Trump yesterday sort of designating a task force, as it were, led by the HHS Secretary, Alex Azar. What can they do? Alex Azar thus far has said, we think it's a big problem in China. It's not an immediate risk to U.S. citizens.
And I would think that's a pretty accurate assessment based on what we know now. But they can, up screening at different airports. We already saw that happen recently. And then further try to direct the medical response, the effort to come up with a potential vaccine. Already some work on that, obviously very early. And we're unlikely to see human tests or let alone something at production scale for a long time to come. But, to try and move that along as rapidly as possible in the case that this does sort of go on for months and spread further in the United States and elsewhere.
Over the past few weeks, we have witnessed the emergence of a previously unknown pathogen, which has escalated into an unprecedented outbreak and which has been met by an unprecedented response. As I have said repeatedly since my return from Beijing, the Chinese government is to be congratulated for the extraordinary measures it has taken to contain the outbreak, despite the severe social and economic impact those measures are having on the Chinese people. We would have seen many more cases outside China by now, and probably deaths, if it were not for the government's efforts and the progress they have made to protect their own people and the people of the world. The speed with which China detected the outbreak, isolated the virus, sequenced the genome, and shared it with WHO and the world are very impressive and beyond words. So is China's commitment to transparency and to supporting other countries. In many ways, China is actually setting a new standard for outbreak response, and it's not an exaggeration. I also offer my profound respect and thanks to the thousands of brave health professionals and all frontline responders who, in the midst of the Spring Festival, are working 24/7 to treat the sick, save lives, and bring this outbreak under control. Thanks to their efforts, the number of cases in the rest of the world so far has remained relatively small. I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus. The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it.